with Kitab Al-Fatihah. Okay, you all sorry, give me 1 second. I need to answer this call. Urgent call I need to answer. Okay, all right. So, which postings have you all done before?
Surgery and ONG.
Surgery and ONG. Okay, all right. So, before I begin, again, the same thing that I always tell students is that we are very sorry. I think we in the department, I think what happened, the quality of teaching, the quality of medical education now, I must say it is not up to the standard that we are expecting. Medical students from, if you look at even at history, medical students always learn with patient. So because we as clinician, we learn by treating patients, we learn by clocking patients, we learn by seeing patients. But doing this online thing is not ideal at all. It is not good at all. But we don't have that much option. We don't have that much option, especially in this age of medical legal and so on so forth. Kalau one of your colleague tiba-tiba dapat infection ke because of us, then we'll be in trouble. Kalau zaman-zaman dulu no problem kan. So I think that's another reason lah. But anyway, we are trying our best. I think that is why we agreed. I think year 3 at least clearer lah. At least you all dah clear. You all do all the online teachings first, and then you do face-to-face later on, consecutive blocks. I think at least you have an idea, you have a plan what's going to happen in your future. Okay, all right. So what we're going to talk today is about nutrition and growth. So this is going to be a very simple punya presentation. It won't be long. And again, if you have teachings with me later on pun, my aim is teachings with me should not be longer than 1 hour lah. 1 hour is the average time. I think that should be enough. Because longer than 1 hour for online teaching kan, semua orang pun tak boleh fokus lah. Ni especially time after lunch ni kan, semua orang pun lagi gemuk semua kan. So I think it's not ideal lah to do long classes. Okay, alright. So I'm going to talk about nutrition and growth, and then on Thursday I'm going to talk about communication skills. Alright, okay. So Allah mentioned, so having proper nutrition is among the commandments of God. Qala Allah subhanahu wa ta'ala, ya ayuhan nasu kulu mimma fil ardi halalan tayyiba wa la tatabi'u khutuwati syaitan innahu lakum aduwwun mubin. O mankind, eat of that which is lawful and good on earth. So Allah commands us to eat something that is halalan, but not just halalan, it must be tayyib as well. So people, especially in Malaysia, we focus so much on halal. Well, halal is very, very important. Having a meal that is halal is of utmost importance. But one thing we forgot is that it's not just halal, it should also be tayyib. It should also be good. And tayyib, it does not mean equal. It means it's good, it is clean, it is hygienic, it is healthy, it is nutritious, so it is good for you at your level, because tayyib for someone may not be tayyib for someone else. Tayyib is personalized to what is your requirement. And a sugar may be important for someone that is having hypoglycemia, for example, but it may not be good for someone that is in hyperglycemic condition. For certain people, milk is good, but for certain babies, even mother's milk is not good. So tayyib is a personalized thing. So tayyib, halal is very clear. Al halalu bayyin wal haramu bayyin is very clear. Halal, what is halal, what is haram, that's clear. But what is tayyib, it must be personalized. It must be personalized. And Allah mentioned, وَكُلُوا مِمَّا رَزَقَكُمُ اللَّهُ حَلَالًا طَيِّبًا وَاتَّقُوا اللَّهَ الَّذِي أَنْتُمْ بِهِ مُؤْمِنُونَ. and eat of the things which Allah provided for you, lawful and good. So Allah mentioned many times halal and tayyib. So tayyib, it has the same legal standing as halal. So if you emphasize so much on halal, you need to emphasize as much for tayyib. So eat something that is good. And also, especially if you look at UIA now, we are focusing so much on the SDG. So this is the WHO, UNICEF Sustainable Development Goals. There are 17 goals to actually achieve in the whole wide world. The 17 goals, you can see them. And there are a couple of the goals which is related to medical, and a couple of them that is related to nutrition and growth issue. First, this is the second SDG, which is zero hunger. So the aim is to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. So the issue is, even before COVID-19, the food issues with food insecurity is already on the rise. And we know that with COVID-19, this will get worse and worse and worse. There are so many people without food. Even if you look at our Malaysian data, since COVID-19, the number of people that is begging for food is actually increasing so much. The number of people that is begging for food that is increasing so much. There are so many people who actually eat whatever they earn for the day. So if they cannot go to work, how can they eat? So this is a huge problem for many people, even in Malaysia. And specifically for children, because we are talking about pediatrics, stunting and wasting. Stunting meaning the height doesn't achieve appropriate height. Wasting meaning the weight doesn't achieve proper weight, are likely to worsen. 21.3% of children under 5 are stunted. 7% of children under 5 are affected by wasting. So this is a huge number. 144 million children are stunted. 47 million of children are wasted. And we know our body, when we are stunted, when we are wasted, the thing is our brain also doesn't grow very well. Our brain also doesn't develop really well. So this may be a huge problem for children. Not just that, the other issue is the SDG number 3, which is good health and well-being. So the aim is to ensure healthy lives and promote well-being for all at all ages. So before COVID-19, we know already that progress in many health areas are continued, but many areas still needs lots of acceleration, mainly issues with tuberculosis. Malaysia, we haven't won from tuberculosis yet. Child health needs a lot of improvement. Maternal health needs a lot of improvement. HIV cover, immunizations, all needs cover. Especially with immunization, we are seeing more and more anti-vaxxer groups. We are seeing more and more anti-vaxxer groups. And with COVID-19, I think it's going to get worse and worse and worse. So COVID-19 is a real major disruption. COVID-19 is a real major healthcare disruptions. So there are other issues. So WHO mentioned, WHO Nutrition and Health Progress Report in the year 2000 mentioned that nutrition is the fundamental pillar of human life, health and development, because it depends on good nutrition. So from birth, infancy, childhood, adolescent, adulthood, old age, proper food and good nutrition are essential for survival. It's essential for physical growth, essential for mental development, essential for performance and productivity, health, and also well-being of human. So we can only achieve this if we get good nutrition and proper food. Good nutrition is also a human right. Everyone has the right to a standard of living adequate for health and well-being of himself and his family, including food. So this is from the Universal Declaration of Human Rights, Article 25, 1. And then WHO Constitution 1948 mentions that promotion of improvement of nutrition is among the specific ways that WHO can achieve its objective, which is the attainment by all peoples of the highest possible level of health. So this is the objective of WHO. Okay, now back to Malaysia. So this is the data that is published recently, National Health and Mobility Survey 2019, published in 2019, Malaysian data, National Health and Mobility Survey that is published every 4 or 5 years. So this under Malaysian National Health and Mobility Survey, it mentioned that 50% of adults are overweight or obese, or 30% of them overweight, 19% are obese. So this is a huge number of obese Malaysian, and 52% of adults have abdominal obesity. Trends of overweight obesity, abdominal obesity continues to rise as compared to previous 2011, 2015. And then for children, 30% of children aged 5 to 17 years of age are overweight and obese. 21% of children aged under 5 years are stunted, which is increasing in trend. 16.6 and 17.7 and now 28.8% on the year 2019. Can you imagine what's the number going to be in 2021? And the number will be much worse. 30% of women in reproductive age are anemic. Continued. So 25% of adults are physically inactive. I don't know what's the number for medical student. And then 95% of adults do not consume recommended adequate fruits and vegetables, which is increasing in trend. More and more adults are not actually consuming adequate fruits and vegetables. 21% of adults are current smokers. 11% are current alcohol drinkers. 2.3% of adults have depression. The thing is, 7.9% of children in Malaysia aged 5 to 15 years of age were found to have mental health problem. So why? Mainly due to poor interaction with their peers. There's one you all are at home, kan? So there's a good documentary in Netflix. What is the name? Documentary, The Social Dilemma. So there's a good documentary in Netflix titled The Social Dilemma. So it shows about the issues with social medias and things. Among the issue highlighted is that, so previously, I don't know your age lah, probably my age, children need to go to school to be bullied. So you are bullied at school. You are bullied in hostels. Bila you balik rumah is a heaven. You are safe at home. You are bullied at school. Ataupun those yang ada problem kat rumah, they are bullied, they are abused at home, and going to school is actually a heaven for them. But the problem now with social media, bullying doesn't stop. So when a child is bullied at school, so the number from data that we have, number of children being physically abused is actually reducing. But mental abuse is increasing because people are being bullied in social media, and that bullying never stops. It doesn't stop when you go back home. It doesn't stop when you go to school. It doesn't stop when you go to shop. It doesn't stop when you go to sleep. It continues all the time in social media. So this is a major problem. This is a major problem. I think my wife works in clinic kesihatan, one of the clinic kesihatan in Kuantan. I'm not going to say which clinic kesihatan because it may come up in YouTube. So she mentioned she've had several cases where children, young teenagers, 14, 13, come to a clinic claiming being depressed, being in a very low mood, unable to eat, unable to sleep, insomnia, and so on and so forth. Why depressed? Because they can't cope with their peers, poor interaction with peers. Dia tak boleh communicate with their peer, dengan kawan-kawan. Sebab apa? Sebab kawan-kawan semua main game. Kawan-kawan dia main game apa tu, Fortnite. Dia seorang dia tak main game. So they don't have any good communication. So this is a problem for the current age. Dulu my age we only play Snake kat Nokia 3210 tu. So sekarang there's so many things kan. So number of children with depression is actually increasing in trend. So 4.7% of children were found to have disability. So not just Malaysia, I mentioned before, this is a global issue. So WHO mentioned, UNICEF mentioned, at least 1 in 3 children under 5 is undernourished or overweight. At least 1 in 3 are undernourished or overweight. And 1 in 2 suffers from hidden hunger, which is all this undermine the capacity of millions of children to grow and develop to their full potential. At least 1 in 3 children under 5 not growing well due to malnutrition. So apa result dia is stunting, wasting, overweight. The triple burden. Globally, 1 in 2 children hidden hunger. This is because of micronutrient deficiency, vitamins, other essential nutrients. So this is continues to be a problem worldwide. Overweight and obesity among children is actually increasing in trend, increasing in proportion. So initially before the year 2000, it was 1 in 10. Now it's almost 1 in 5. Number of stunted children has declined in all continents except in Africa. Okay, all right. And then triple burden, which is malnutrition. And the result of triple burden is stunting, wasting, and overweight. So 2 in 5 infants under 6 are exclusively breastfed as recommended. Under 6 months, only 2 in 5. And then use of breast milk substitute is a concern. Sales are actually increasing. Poor diets actually drive malnutrition in early childhood. Only 1 in 5 children from the poorest household and rural areas is fed with the minimum recommended diverse diet for proper growth and brain development. So 4 over 5 of them has not been given the adequate. So many school-going adolescents consume highly processed food, nuggets, and so on and so forth. And 42% drink carbonated soft drinks at least once per day. So triple burden, how it harms. So triple burden is undernutrition, hidden hunger, and overweight. So triple burden, undernutrition, the effect is stunting and wasting. The effects is poor growth. The child will be easily infected, immunosuppressed, and may result in death. The child may have poor cognition because of impaired development, poor school performance, obviously poor earning potential in later life because the child is not performing and is not productive really well because of undernutrition. Hidden hunger, where there is deficiency in micronutrients, you can see poor growth and development as well. There will be poor immunity, immunosuppressed, and poor tissue development, poor health, and risk of death as well. Among them is like zinc deficiency. In Malaysia, zinc deficiency is among the cause for immune-related issue, infection, and so on and so forth. Vitamin D, vitamin D deficiency is quite rampant in Malaysia as well. Studies have shown almost half Malaysian is actually has low iron levels. Also iodine. Iodine is a problem as well. That is why in Malaysia now we are going back to the iodinized salt, garam dapur tu with iodinized, with iodine. And also vitamin C. You'll be surprised. Actually, this year we in our hospital we have 1 case of scurvy. Do you know what is scurvy? Scurvy is vitamin C deficiency. So we have a patient with vitamin C deficiency. In Pahang, Pahang is among the states that still have problems with protein energy malnutrition. We still see children with protein energy malnutrition, kwashiorkor, marasmus. So these are all third world diseases that we still have in Malaysia. So this is a huge problem still in Malaysia. Overweight, including obesity, you can see the short-term ones, cardiovascular problems, heart failure, infection, poor self-esteem, and long-term is obesity, diabetes, and other metabolic disorders. Effects. So the other effect is the issue with globalization. Globalization is among the cause and among the problem that causes all these nutritional issues. So globalization, urbanization, inequities, humanitarian crisis. Okay. Yeah? So among the problem, if you see, the issue is healthy diet, healthy food is now a luxury. Healthy food is a luxury because it's expensive. If you want to eat something that is natural, the cost is expensive. If you want to eat something that is lots of fruits, salads, and so on and so forth, the cost is more expensive than a cheeseburger, for example. So low quality low nutrition, bad food costs very, very cheap. Maggie mee, it's very unhealthy, nothing in it. But the cost is very, very cheap. But to get proper nutrition, proper healthy food, the cost is expensive. So this is the problem with globalization. So we have an excess, we have an abundant access to food deserts. We have an access to a low quality, poor nutrition food. So this is the problem. And high quality, high nutrition food are getting more and more expensive. So this is the problem. I actually want to show you the growth chart, but so this is the problem. So okay, so basically there are two types of growth chart: the Fenton growth chart and IHDP growth chart. There's several growth chart. WHO has growth chart as well. KKM, we reuse the IHDP growth charts. So basically growth chart, if you see growth, so growth chart ni dia ada few lah. So you akan tengok dekat growth chart tu dia ada male, female, different growth charts. Less than 2 years old, different growth chart. More than 2 years old, different growth chart until 18 years old. Dan kat growth chart tu you ada weight, ada height, ada head circumference, and you can even see the growth velocity, and in some of them you can see BMI as well. So you need to plot the growth chart. So as students, if you clerk patients, if you clerk pediatric patient, I expect you to actually plot the growth chart. We have asked in exam many times whether you know how to plot the growth chart or not. So always plot height, weight, and also head circumference. And ideally, you need to plot the trend as well. You need to plot the trend. The issue is, sometimes bila you present, medical students, bila you present cases, if you do not tell us the anthropometric measurement, what is the weight, what is the height of the patient, then that is not acceptable. So in pediatrics, we expect you, one of the requirement actually for you to actually tell us what is the weight of the child, what is the height of the child, what is the head circumference of the child. Not just in kilos, centimeters. We want you to actually mention in which centile is the weight. So weight is 5 kilos, which is berapa centile. Height is berapa centimeter, which is berapa centile. So we expect you to know this. If you do not tell us, then you do not deserve to pass. If you do not tell this, you do not deserve to pass. It is compulsory upon us to fail you if you do not do this properly. Okay? All right. So you need to plot growth chart properly. For children less than 2 years old, if the child is premature, for example, so you plot on the corrected gestational age. For example, I can open my chart here. If not, you can see. For example, if the child is born 36 weeks premature, so term is 40 weeks. So if the child is born 36 weeks premature, so the child is 1 month early deliver. So when you plot the growth chart, you plot, so maknanya kalau umur dia 2 bulan, you plot at 1 month, because 1 month is the corrected gestational age. If the child is born 28 weeks, the child is born 32 weeks, for example, so it's 2 months early. So when you plot at the corrected gestational age. So chronological age is 3 months, tapi dia punya corrected gestational age is just 1 month. So CGA, corrected gestational age, is the age yang you use untuk plot growth chart and development as well. So maknanya if the child is born early by 2 months, kan, early 2 months, 32 weeks gestational age, the child is born. They born premature 32 weeks, main 2 bulan awal. So kalau usually you expect the child to be able to walk by 12 months. So this child, you expect the child to be later by 2 months lah. Maknanya by 14 months baru you expect dia boleh jalan. Sebab dia born early by 2 months. Faham tak? Faham tak issue with corrected gestational age ni? The other issue is certain syndromes. Certain syndromes have different growth chart. But we have so many syndromes, tapi the only syndrome yang ada growth chart sendiri is the Down syndrome. So children with Down syndrome, they have their own growth chart. So Down syndrome patients can come in your exam, have come in your exam, have come many times in your exam as well, and will continue to come. So if you have patient with Down syndrome, when you plot the growth chart, do not plot in the normal growth chart. Plot in the specific Down syndrome growth chart. Okay, all right. So worldwide prevalence, South Asia 49.9% prevalence of children under 5 who are not growing well, basically stunted and wasted or overweight. This is the value by 2018. Undernutrition. Undernutrition continues to affect tens of millions of children and visible in stunting, especially important in the first 1,000 days of life, because this is the time when your brain is actually developing. If you are undernourished, your brain may not develop adequately. So you won't be, taklah jadi cacat, tapi you won't achieve your full potential. You won't achieve your full potential. So elok-elok boleh jadi doktor, you jadi politician for example, kan? Sebab brain tak develop proper. Sebab tu jadi hari biru macam sekarang ni. So that's the problem. So they may carry the burden of early stunting for the rest of their lives and may never meet their full physical and intellectual potential. So so undernutrition is also evident in wasting. Okay, in 2018, 114 million of children under 5 were stunted and almost 50 million were wasted. So this is the data published by WHO in 2019. What is hidden hunger? So hidden hunger are deficiencies of essential vitamins and minerals, often referred as micronutrients. So micronutrient deficiency. So what it does is it robs the children of their vitality at every stage of life. It undermines the health and well-being of children, young people and women. It causes problems such as scurvy, rickets. It causes problems such as immunodeficiency, skin diseases, and so on and so forth. The problem with hidden hunger is that hidden hunger ni tak berapa nampak. And to diagnose it is not easy. It takes months to actually diagnose hidden hunger. And diagnosing is not easy, and usually when we diagnose, it's already very late in the disease process. It's already very late in the disease process. Like the case with scurvy that we diagnosed, I think this year, we only not this year lah, 2020. It took us months to actually diagnose that this actually is vitamin C deficiency. We start the child on vitamin C, and then the child start to better. The child came in with muscle weakness, muscle pain, inability to walk, inability to ambulate, poor muscle tone, reduced power, and so on and so forth. Overweight and obesity. Number of obese girls and boys between age 5 and 19 have increased since 1970. It is increasing by 10 to 12-fold globally. Previously, we always see, dulu overweight ni is seen as a condition of the wealthy. I remember when I went to Egypt, among the they always say that if a father wants to let his daughter to get married, he looks at the tummy of the potential husband. So if the tummy is flat, then not good, because flat tummy is considered as poor. If you have boncet, if your tummy is big, if you're overweight, then it shows that you are rich. So previously people understood that obesity is a sign of wealth. The more overweight you are, the more wealthy you are, the more rich you are. But now the problem is overweight and obesity is increasingly a condition of the poor, because cheap calories are very easy to get. Fatty, sugary food are easily available, and it's much cheaper than nutritious and healthy food. You need to go to gym, you need to go to, for you to have active lifestyle, you need to have equipment. Dulu when I was young, I used to play. Behind my house is forest, ada jungle kat belakang rumah. Rimau pun ada. And I used to play, main biji getah, panjat pokok. But children nowadays, they don't play with those things. They don't even know what is biji getah. Kan? They don't know. They don't play outside. Sekarang COVID lagi, you cannot play outside, because COVID you can only play in your own house. And the thing is, how many, only richer people have good laman, garden in their house. So if you want to go to gym, you need to pay. If you want to go to have healthy lifestyle, you need to have resources, and those resources cost money. Nak beli basikal pun ribu kan. So it's expensive. So not being healthy is cheap. Just sit down and watch TV. It's cheap. It's cheap to be fat. To get fat is cheaper than to stay lean and slim. So this is the problem. What are the essential nutrients? So these are the things which you should have known: glucose, fat, linoleic acid. These are the types of protein that are essential, and essential minerals, vitamins, and so on and so forth. Okay, so across a lifespan, so malnutrition, what it affects in embryo and fetus life. Common nutrition disorders are intrauterine growth retardation, iodine deficiency disorder, folate deficiency, and the consequences are low birth weight, brain damage issues, neurotip defect, stillbirth. In neonatal effect, neonatal period is low birth weight, iodine deficiency disorder, growth retardation, developmental retardation, brain damage, early anemia, infant and young children, PEM, IDD, vitamin A deficiency, iron deficiency, and anemia. And these are the effects: malnutrition, goiter, blindness, anemia, immunosuppression. In adolescent, it's again PEM, IDD, iron deficiency, and anemia, folate deficiency, calcium deficiency, results in delayed growth spurt, stunted height, delayed or retarded intellectual development, goiter, infection, blindness, anemia, adequate bone mineralization, and so on and so forth. And these are at the other ages. So malnutrition and IUGR. So IUGR is major clinical and public health problem in developing countries. Even in Malaysia as well, we always have patients. Almost every day we'll have babies delivered with IUGR. And the major determinant is maternal malnutrition. Maternal anemia, GI and respiratory infection, malaria, cigarette smoking are also important etiological factors, because cigarette smoking can cause vasoconstriction. And causes placental insufficiency as well. So IUGR significantly increases risk it poses for the infant and young child, increased malnutrition, morbidity, mortality, poor cognitive and neurological development, even issues at neonatal period. Also, risk for diseases at later in life: cardiovascular disease, high blood pressure, obstructive lung disease, diabetes, and renal disease. Okay, vignettes. Nutrition is an important determinant of growth and development and health. So nutrition is very, very important. It's very essential of growth, development, and health. Nutrition history is important in clerking. If you clerk any patient in pediatrics posting, you need to ask about nutrition history. Nutrition history ni is not adequate. You just kata macam a normal adult diet. Because normal adult diet may be different according to different adults. You may eat differently. So normal adult diet is not enough. So you need to get more history. What did the child eat for breakfast? So in pediatrics posting, always ask nutrition history. Always ask birth history. Always get developmental history. So nutrition history is actually important part of clerking. What did the child eat? How long was the child exclusively breastfed? What type of milk? If formula milk tak cukup, susu formula je. Tanya susu jenis formula apa? Because I've seen patient in Malaysia. Came in with wasting. Bila kita tengok, the problem is the mother has been feeding this infant and less than 1 year old with susu pekat. Mak dia cakap bila kita tanya bagi susu. Tapi bila kita tanya properly, actually susu yang dia bagi itu is susu pekat. And we know in Malaysia, susu pekat is not susu. Susu pekat is not susu. It is just colouring, sugar and colour and sugar. That's it. It's just colour and sugar. It's nothing else. It's not even milk. So this is a problem. So always get full nutritional history and always get the anthropometric measurements. But as I said before, the centimeters, the kilos are important, but more important is actually you need to plot in the growth chart. What does the weight and height and head circumference falls on the centile. And then remember as well, we as doctors, we look at the patient as a whole. Patient as a whole, wholesome, as a human being, not just the physical aspect, but also nutrition, growth, social development, and so on and so forth. Okay, all right, that's it. 39 minutes, that's good. Any question? Faham? Clear? Boleh dah? Need to get full history, you understand? Need to get proper developmental and growth. Okay, dah? Tak ada soalan? Clear? Ketidur belaka dah? Dua orang ni yang tunjuk kamera ni. Lain
Clear,
semua
clear.
tengah main game ke?
Doktor.
Tiba dua orang muncul. Tiga orang. Bagus. Okay, right, yes.
Doktor, saya ada soalan. Okay. Yang regarding the apa? Yang preterm growth chart for preterm baby tu, I just want to clarify actually. Let's say like the baby was preterm 2 months earlier. So which means that kalau kita nak plot the growth chart tu, maknanya 2 months later daripada gestation age. Lah kan?
Yes. Bukan 2 months later, 2 months later lah. So maknanya, contohnya, budak ni born 1st of June, for example, my birthday, 1st of June. So baby ni born 1st of June. And like me, the child is born 4 weeks early, so 1 month earlier. Contohnya kan. So bila kalau you jumpa patient tu 1st of July, for example. So bila you plot growth chart dia akan add 0 lah. Dia akan add 0. Sebab sepatutnya dia lahir 1st of July, tapi dia lahir 1st of June. Lebih kurang lah.
Saya tak faham sangat kenapa add 0? Bukan add 1 ke?
Sebab chronological age dia 1 bulan, betul?
Betul.
Corrected gestational age dia 0 lah, sepatutnya dia baru lahir.
Sebab dia macam dia tolak balik. Okay. Okay, thank you doktor.
Yep. Okay, any other question? Any other question?
Doctor.
Yes.
Just want to ask regarding our next lecture.
Thursday.
Yeah, Thursday.
Thursday ni problem sikit lah because I have so many things. In the morning, because I need to do rounds, and then in the morning I have year 2 lecture, and then I have probably I need to do grammar round with pediatric teams. Okay, let's say we put first at 3:30 p.m.
Okay.
So we put at 3:30 p.m. And then we'll see. Let's do 3:30 p.m. 3:30 p.m. If anything, then I'll get back to you. Okay. All right. Okay. That's it. Okay. Let's end our session with tasbih kafarah and surat al-As. Assalamualaikum warahmatullahi.
Waalaikumsalam. Thank you doktor.
Waalaikumsalam. Thank you doctor.
Thank you, doctor.
Thank you, doctor.
Thank you, doctor.
Thank you, Doctor.